accelerating improvements in care, getting hospital boards on board. The Institute for Healthcare Improvement has initiated a variety of national quality and safety initiatives. The 100,000 Lives campaign took place from January 2005 to June 2006 and asked hospitals to prevent unnecessary patient deaths. The 5 Million Lives campaign aims to protect patients from incidents of medical harm over a 24-month period by December 2008. As momentum grows across the country for these campaigns, it is critically important for hospital boards to recognize opportunities and set clear expectations and goals for improvement. A board member's role. Quality Committee.
The purpose of the Quality Committee, in my opinion, is to help the board focus more completely on quality and safety issues within our institutions. The Quality Committee is meeting on a monthly basis and working to in-depth understand those issues that this hospital faces regarding the quality of services to its patients, and then to interpret that to our board as a whole. Quality Committee is working very hard at educating the board in this new initiative. They're giving us homework to do. I've just read a book that was developed by the Joint Hospital Commission to assist us to understand those concepts. The meetings are very in-depth. They include extremely intelligent, forthcoming reporting from staff in the hospitals regarding those opportunities they have for improvement and the systemic things that they're doing to try to make those improvements.
A board member's role. Hospital responsibility.
Being a board member is a big responsibility. I'm spending a fair amount of time becoming educated because there are, as a community member, there are many very sophisticated, complex issues that are going on in this hospital. And for me to understand them and to ask the right questions, I have to spend time and energy learning what those protocols mean. One of the things that I learned as a board member is that you can't get better by simply saying you're going to do better. That human beings are human beings and we make errors. That the answer to safety and quality in a medical setting is about systems and about protocols and assuring that our hospital is adhering to those best practices that are known nationally.
A board member's role. Community responsibility.
Our role as community members is to reflect the values that our community has and to make certain that our hospital is meeting the primary needs that are presented in our communities. I think it is to reflect as best as possible, as I said, the values that our community has and to be a safeguard for the community, to be a watchdog for the community, if you will. That sounds like a difficult term, but in fact, part of transparency is to assure that someone is in fact watching and listening to that transparency and reflecting what that means to them as a layperson in the community, as someone who is representing this institution. And so there's a very high standard about that. We have a role to question and to prompt the managers of our medical institutions to do better and to hold them accountable for the actions that they do take and in fact what specifically is improving as a result of those actions. When people come into a hospital or into a healthcare situation, they're very vulnerable. So one of the other things that I think is important about this hospital and this initiative is the inclusion of patients in that care. A well-informed patient is a first line of defense. They're much less vulnerable if they're included in those care situations. My husband recently had an outpatient surgery in this hospital. I have to say, when he came into the hospital from the very beginning, his anesthesiologist came in and made a decision with him about the best approach for his anesthetic based on his health conditions. His surgeon met with him because he had a specific question for his surgeon. He was treated completely with respect and always included in whatever the activities were that were going on. Because I think as an engaged patient who's well informed, he's much more likely to be safe. He's much more likely to say, you know what, I have a problem if you're going to do that because of this. Including patients in this initiative that we have is a very important piece of this.
A board member's role, personal pride.
The idea that, I joined this board, I'm very proud to be on this board. I think this is a wonderful institution. I understand after coming onto the board that part of the reason that it's a wonderful institution is that it understands that it can be better. And so my role isn't to sit here and simply say this is the best institution in the world, although I believe in it very much as a board member, and I am very proud to be a part of it. I understand that every day there are incremental ways that we can be safer and better, and that makes me even more gratified to be participating in that. It's my hospital. For 40 years I've used this hospital. My family's used this hospital. It's an important institution in the community. It's a community treasure. And so my role in helping to safeguard that and make it as good as possible, though a small one, is critically important to me.